The President should ask the Secretary of Health and Human Services, Kathleen Sebelius, to resign her position because of the disastrous rollout of Obamacare. Taxpayers have spent $400 million to create exchanges that after 3.5 years still don't work. As a result, the White House had to announce last night that the key enforcement mechanism to their individual mandate, a $95 fine that increases every year, will be waived until the end of March of next year. That's fine for those currently without insurance, but for the millions being forced into the exchanges and losing their current insurance, there's no relief, just higher prices, a likely lapse in insurance coverage, a broken website, and broken promises. We already know of 1.5 million Americans who are losing their policies because starting January 1, many insurance policies that they now have will not be legal under Obamacare, and because the exchange will not be working, they won't be able to choose another policy. This chart gives an example of what's going on. Just in 3 states, California, Florida, and New Jersey, there are 1.4 million insurance policies that won't be valid after January 1 because they're not legal under Obamacare. Compare that number, 1.4 million, to the number of Americans in those 3 states who have reportedly applied on the website for insurance. So 7 or 8% of all the people who will lose their current policy have applied for a different policy. That's what's really going on across this country in families as people worry about health care. These are policies in the individual market. There are 19 million Americans in the individual market. We also heard on NBC News over the last couple of days that the Obama administration knew that 47 to 60% of the policies in the individual market wouldn't be legally offered under Obamacare, yet still said to people, if you like your insurance, you can keep it. Mr. President, at some point there has to be accountability. Expecting this secretary to be able to fix what she hasn't been able to fix during the last 3.5 years is unrealistic. It's throwing good money after bad. It's time for her to resign, someone else to take charge. No private sector chief executive would escape accountability after such a poor performance. And the principle of accountability is not and should not be foreign to the public sector. Admiral Hyman Rickover, father of the nuclear Navy, told his submarine captains that they were not only accountable for their ships, they were also accountable for the nuclear reactors on their ships. If anything went wrong with the reactor, the admiral said, your career in the Navy is over. As a result of that dose of accountability, since the 1950s, there's never been a death as a result of a problem with a naval submarine reactor. Americans deserve that kind of accountability in the implementation of the new health care law. Instead, the Secretary appears not even to have told the President about known problems with the Obamacare website in the months and days leading up to the launch. Despite repeated requests, she's refused to tell Congress or the public the reasons the Obamacare website continues to fail, while insisting on more time and an undisclosed amount of money to fix it. Before the internet, RCA knew how many records Elvis was selling every day. Ford knew how many cars they were selling every day. McDonald's could tell you how many hamburgers it had sold each day. Yet here we are in the advanced stage of the internet age, and under Secretary Sebelius' leadership, the Obama administration will not tell us how many Americans have tried to sign up for Obamacare, or how many have actually signed up for Obamacare, or what level of insurance they've purchased, or in what zip code they live. Not only can they not tell us, they've done their best to keep us from finding out. With WikiLeaks and Edward Snowden spilling our beans every day, what's happening on the Obamacare exchanges is the best kept secret left in Washington, D.C. The National Security Agency could learn something from Secretary Sebelius. Today, Mr. President, I will ask unanimous consent later today to approve a 6-page bill I introduced yesterday to require the administration to answer these questions every week. Secretary Sebelius is not responsible for enacting Obamacare, but she has been responsible for 3.5 years for implementing it. Now, many Americans have only a few weeks to purchase new insurance or be without health insurance. To expect the Secretary to correct in a few weeks what she's not been able to do in 3.5 years is unrealistic. Mr. President, it's time for the President to ask the Secretary of Health and Human Services to resign. I thank the President and I yield the floor.